a reevaluation with a patient who is in my martial arts community. And because of his wear and tear on his body, multiple degenerated discs, generated hip acetabulum, this man was staring at multiple surgeries and fusions. Just yesterday was an 8-month reevaluation, and this gentleman not being able to go from sitting to standing and not being able to walk without complete antalgic pain and radiation into the foot from the low back. He just went to Mexico with his family, has a newborn, hiked up and down pyramid temples, went kayaking in the ocean with his family, lived life. That's the value of these types of therapeutic services, is its quality of living.
We all know what regenerative medicine does and how amazing and miraculous the results are. Everybody, this is Dr. Mark again, the Stem Cell Doc, getting ready to start another podcast with Dr. Atlee Wampler, a very, very dear friend of mine for, 15 plus years now. It's been quite a long time that I've known this man, and what a true gentleman and one hell of a doctor. And I'm so glad to know him, and I want to bring him on the podcast now, and we're going to talk about regenerative medicine. Dr. Wampler's practice down in Atlanta, Georgia, which is called Veris Spine Joint Centers. And he's going to tell us a little bit about what he does. How you doing, Dr. Wampler?
I'm fantastic. God bless you. It's good to see you, my friend.
Good to see you too, man, as always. I don't see you enough. That's the problem.
I know.
And you
but
still
we have
look
known
good,
each other
man.
a good long time. Like you said, we've had an amazing run together.
Yes, absolutely. It's been, it's got to be over 15 years, I'm sure.
It is.
And it's been such a pleasure on our professional life, but for me, probably you too, our personal life, as we're both diehard Christians and just have very similar lifestyles. So what I would love for you to tell everybody is about yourself, and we'll get into talking about your practice.
Thanks, Mark. You and I have known each other for quite a long time, and we share a lot of parallels in our life, both professionally and personally, like you said, spiritually, as well as many of the similar type of accomplishments. And that's why I've always admired you, and not only consider you one of my close personal friends, but also a mentor to me business-wise. And I've always been able to come to you and get sage advice whenever needed, which seems to be quite frequently.
You're not
alone. People get involved in regenerative medicine for one or two reasons, and for me, it's either going to be because of a personal experience for yourself or for that of a loved one who needs it, because standard medical techniques have come up short in finding the resolution to their health problem that they're experiencing. And for me, I'm a lifelong martial artist, and that journey has led me into my professional studies, my doctorate of chiropractic, my master's degree in sports injury management, my personal public practice, where we have evolved over the last 22 years into a regenerative medicine facility where we take care of a variety of different health problems now, not just limited to the joints and spine of the body, but of course, in that quest for truth, as well as for personal necessity, for the rehabilitation and the regeneration of injuries that I've accumulated over my athletic career. My personal drive and professional purpose has become to try to help as many people as possible through the utilization of regenerative medicine techniques, and to try to give as many people as possible an alternative choice to the drugs and surgical model that's so prevalent here in America.
Yeah, I totally agree. And I'm so happy that you're on that path. You brought up your history, a little bit about your history. What people don't know about you that I know is this one bad man right here. This guy's got some skills.
I was just beginning my jiu-jitsu journey, I think, when we first started befriending one another. But my father worked for the government, and martial arts was mandatory in my family. And so my three sisters, my mother and my father and I all have at least a first degree black belt in Taekwondo. And that's
Hmm.
just something that we did as a family growing up. And then a lifelong dream for me, amongst many others, was to one day go to Korea and study in what's called the Kukiwon, which is basically HQ for Taekwondo.
Hmm.
And when I got there, my roommate at the time, I took a job teaching English as a second language and was training and competing there. And my roommate encouraged me to come and meet a master who introduced to me and uh, trained me to become the second non-Korean to ever achieve a black belt from the Korean Hapkido Federation.
Wow.
And so I was training and competing internationally there, and I had a variety of different injuries that came my way. And I quickly found out that my martial art master was not only internationally renowned as a hand-to-hand combat instructor and for the Republic of Korea Special Recon Division, but also he was nationally renowned as a healer. And people would come from all over Korea just to see him in between his teaching of martial art classes. He would do healing sessions, and he was a bone setter. He was an acupuncturist. He used frequencies of sound and light, far infrared, and I had some miraculous recoveries that I knew that would not have taken place in the standard model here back in the United States. And my roommate at the time had been accepted to chiropractic college and had the brochure to Western States Chiropractic College in Canada. And I flipped through that thing, and everything looked like it would be the coolest class to take. And so my martial arts journey has really led me into what I do professionally, because as my master in Korea once told me, it was kind of a challenge to step up to the plate. But he says, if you only know how to take somebody apart and not put them back together, you're a menace.
Hmm.
But to be a true master, you have to be able to do both.
Hmm.
And so, where I thought I was at the pinnacle of my martial arts journey, I quickly realized that I was just in the beginning, and that to truly continue, I had to start learning how to put the body back together and how to heal it. And so, my experiences in competition and in recovery from injury back in Asia really led me towards finding uh, healing techniques and healing products and procedures that were not, I had not been introduced to them before, but were
Hmm.
extremely effective, and that did not involve pharmaceuticals or surgical interventions. And of course, that's where my natural bent lies.
Hmm.
And so I myself have benefited significantly from stem cell therapy.
Hmm.
And I've had treatments in both of my knees, 4 levels of my lumbar spine, and both shoulders. And I was on professional disability back in 2015, not being able to move before we were able to, we got introduced to some of these stem cell procedures. And uh, I was in really bad shape from the accumulation of injuries that, from my athletic career. And I was a chiropractor, and I was still, my body was falling apart. And so another personal quest of mine was not only to find solutions to myself, but for my patients, in that I was able to help people, but I wasn't able to fix it.
Hmm.
And so it's my perpetual journey, to learn more and more. And as technology evolves, and finally the laws in the United States caught up to the international community, and we started to be able to do some of these regenerative therapies back in 16 and 17, as the FDA began to be forced to open up the door to some of these treatments. And I got to tell you, Mark, I haven't had a surgery since.
Well, that's
And
amazing.
so, yeah, and so it's my testimony. And, as I was telling you, one of the things that your fans probably don't know about you that I do, and that we share in common, is that we're both Eagle Scouts. And in fact, I have two sons, and both are scouts. And I'm about ready to take 60 Boy Scouts to summer camp for a week.
Wow.
And I'm going to tell you that 10 years ago, if you had told me that I was going to go spend a week sleeping on my back in a tent in the woods, and that I was going to have to hike up and down the North Carolina Appalachian Mountains all day for a week with my knees, I'm going to tell you that would not have been possible for me. But I can't tell you how excited I am to spend this time, not only with my sons, but to be able to influence countless other youth of America in a positive manner. And it's all because of the regenerative capabilities of stem cell therapy.
That's awesome. What a great story. You're so lucky that blessed to have
Yeah.
mentors like that in your life that have helped lead you and teach you about the principles of healing. And I mean, I say it all the time, there's no better testimonial than yourself and you, your family, you're living proof, myself. I mean, this is how we started. We all had these horrific injuries that basically took our quality of life away from us.
Mm.
And now we're not just surviving and getting by, but we're thriving. We're doing all the things that we love to do that we couldn't do years ago. And what a true blessing that we get to share this with everyone out there.
You know the testimonies as well. So
Hmm.
there's nothing more rewarding than to see the restoration of someone's quality of living.
Yep.
I
Absolutely.
just had a reevaluation with a patient who is in my martial arts community, and because of his wear and tear on his body, multiple degenerated discs, degenerated hip acetabulum. This man was staring at multiple surgeries and fusions, and fortunately decided in a whim to reach out to me. Even though we were in the same community, he never thought to reach out and explore what stem cell therapy might be able to do for him. And of course, we educate our patients thoroughly on all the different types of regenerative procedures available, but which one's best for you in
Hmm.
your specific instance. And uh, just yesterday was an 8-month reevaluation, and this gentleman went from not being able to sit, not be able to go from sitting to standing, and not being able to walk without complete antalgic pain and radiation into the foot from the low back. He just went to Mexico with his family,
Mm.
has a newborn, hiked up and down
Wow.
pyramid temples, went kayaking in the ocean with his family, lived life.
Mm.
That's the value of these types of therapeutic services,
Mm.
is its quality of living. We like to say that we not only put years back into your life, but we're putting life back into your years,
For sure.
right?
Absolutely. Yeah, what a great story. And again, we're so blessed that we get to do this with patients and so rewarding, heartfelt. And part of what, as you know, I do for a living is I get out there and I actually help teach and train other doctors and providers on how to provide this service because there's just not enough of us doing this. And
Right.
the more of us that can do this, the more people's lives we can change. And that's been my goal and my mission. And we are so thrilled that you are part of the whole Stem Cell Doc affiliate program. And you are in the most unbelievable location too, Atlanta, which is, correct me if I'm
Atlanta, come
wrong,
on down.
one of the largest international airports you could fly into.
Well, it's a first class facility. Very proud of it. You can fly right in. We have two different hotels right next door. If an overnight's required, we can make all arrangements for you. These are a la carte services. We are here to serve. And in fact, the reason why Dr. Harper and I put this together after rebounding from the COVID pandemic is because we want to give, especially Americans, the ability to get these services without having to go abroad, right? And to know that the quality and the consistency of not only product, but outcome is gold standard. And
Hmm.
that's, of course, one of the reasons why I admire you so much and why I love doing business with you, is because I don't have to worry about second rate, product or customer service. And I know that you personally actually third party laboratory test every single product that you stamp your name on as the stem cell doc. Now, you and I both know that most tissue banks will do their own in-house testing as required by the government on their products. But I know that you actually take the further step in hiring out at your expense an independent laboratory without the personal bias
Mm-hmm.
to get the real. Because especially in regenerative medicine, apples aren't all apples.
Mm-hmm.
And once again, it's what type of regenerative procedure, product, and combination of treatments are going to provide the best results for you personally with your injuries. We're all bio-individual, and
Mm-hmm.
our injuries are all unique to us. And
Mm-hmm.
while you are unique as a child of God, Dr. Mark, your story and your injuries are not. Right?
Thank you. I've lived quite a life, just like you, and I've suffered through some of the fun I've had. But
Yes.
thank God that we do have regenerative medicine, and I do take pride in the products, the quality of service. It means a lot to me, and I sleep very well at night knowing that the procedures that we do and the products that we put into people's bodies are the very best that you can get in the world, and and the difference shows. You could see it in the patient outcomes. I mean, our success rate is so high, I don't think we're even allowed to say it, but it is that amazing. Um, and the cool thing is we've developed enough offices all around the country to where anyone that calls in can literally see anybody around the country to make it convenient for them. Um, but what I do like about your office is you have some unique stuff in there, some things, some procedures with you and Dr. Harper that do that some don't have and don't do. So can you tell us a little bit about what goes on there?
Dr. Harper is a 30-year anesthesiologist and the top doc that I've had the privilege to work with uh, as far as being an ethical and a compassionate technician of generally unpleasant techniques, right? He's an anesthesiologist, so he does a lot of injection work and has for over 30 years. And so he does epidurals and nerve blocks and intradiscal and intrajoint injections regularly. And it's just that, he does them with the standard regularly with the most standard, pharmacology and orthopedic techniques and pain management techniques. So when we got together and started doing regenerative work, his eyes were opened as to the results that we were obtaining. And he would prefer to use regenerative medicine whenever appropriate. Of course, because it's not a covered service or covered product by insurance or by Medicare, we're limited into those patients who can afford these types of services, but we definitely want to be able to give access to them.
Sure.
And so he can treat a variety of people with a variety of conditions, with a variety of techniques that he utilizes every single day. And if you have a disc degenerative problem, if you have, any type of severe situation, whether it be autoimmune, he has not only the background, the experience, but also the techniques to be able to treat appropriately. Because once again, not every regenerative technique, delivery system, product is appropriate to get the ideal result with every single person. So you want that group that can personalize these treatments to you and your specific issue. And once again, we don't treat disease and we don't mitigate disease processes because I don't care what it's called, but when you put stem cells into the body, the FDA has actually used their own language stating that stem cells repair, replace, and regenerate damaged, diseased, and even dead cells. And so if you have degeneration, an injury, regardless of where the location is, stem cell therapy just might be an appropriate option for you to recover from that
Mm-hmm.
health concern.
Mm-hmm.
So the big question is you want to get the right product, and you want to get the right procedure, and you want to get the right person to deliver it. And
Right.
someone who does these types of deliveries every single day is the guy that you want. The only
Absolutely.
difference is what's in the needle. And that's
Mhm.
all the difference in the world.
Absolutely. Yeah, the quality of product is everything. The fact that you have an expert down there with you makes it even more reassuring that you're going to get the very best of care, no matter what your
Well, and
condition
he's
is.
also a patient himself. So Dr.
Sure,
Harper and I, we're
sure.
not just the president, we're also a client. So he himself has them in his shoulders and in his knees,
Mhm,
and it we are living testimonies as to the restoration of function, the relief of pain,
mhm,
and the increase in quality of living that regenerative medicine can provide one.
mhm. Awesome. And you know, the cool thing about this is if anybody's listening to this that is a doctor, provider, even a business person, if they're interested in opening or adding regenerative medicine to their office, part of our program is to come and train everyone in your office. And I love knowing that you got Dr. Harper on your side because if we need anybody that needs special training in those procedures, I know we could send them down there and he'll train them up very good. Since the inception of regenerative medicine and the word stem cells and exosomes, we've had to kind of tippy toe around the regulations, and we have different terminology, even though it's the same language as the FDA, as to how we can talk about it and promote it. And we have to always be in a line with the FDA. Um, but when the FDA brought out their regulations stating just what you said, I was so happy that through all your research and studies, people probably don't know this, but you wrote a pretty amazing article about Wharton's jelly. And I did got to tell you, any doctor that's in my circle, I have them read it because you are so spot on with what the FDA is looking for us to say. Now, again, at the end of the day, we all know what regenerative medicine does and how amazing and miraculous the results are. But we still have to stay parallel to the regulations. And you know, I don't want to quote everything in your in your article, but it is such an amazing article. Is it okay if I say the name of the article?
Sure.
Yep, it's Wharton's Jelly is exceptional homologous intra-articular disc and joint repair. And the little quote that you just said about the repair and reconstruction and is so spot on, you know, because we do have to be careful of how we promote regenerative medicine and how we market regenerative medicine to our patients. Um, but I will tell you, the future is right now with regenerative medicine. It's in every form of medicine today, you know, and it's only going to keep growing because people are really tired of being medicated, over medicated, having unnecessary surgeries, failed surgeries. This is now an alternative method that has such a high success rate with no downtime. There's no pain involved. You literally come in for the procedure and you go home, and these little guys go to work in your body and start doing what, you know, God meant them to do, which is repair and regenerate and bring your body back to homeostasis. So your quality of life is better. And I encourage everyone who doesn't know about this article uh, to pick it up, read it. Really amazing. I'm
Thank you.
really
I'm the
proud of
son of
you.
an attorney and an English teacher.
Well, you could definitely tell because you know when I train people, I have this article with me and I have it highlighted on the exact verbiage that you need to employ when you're doing regenerative medicine in your office to stay compliant. And that's a very big deal, staying compliant. Um, I almost wish we had no restrictions because we could treat everyone with every condition and we could stand up and say it out loud. But unfortunately, the regulations don't allow that. So we have to be very careful how we speak about regenerative medicine. But you and I and thousands of patients know the truth, which is why, you know, again, I live in Maryland. My office is in Towson, Maryland, and I got to be honest, I don't see a lot of people from where I live. most of the people fly in from all over the world. And because they know about regenerative medicine, they've heard about us, the quality of our product. And we've been very fortunate to treat a bunch of professional athletes, A-listers that have gone public with this stuff, and it's gone viral. Everybody wants a better life. And now there is a chance to have it.
Well, I tell you, Mark, it's the only way I'm staying on the mats. So yes, I still train in jujitsu, and it's just a blessing because I can do the things I want to do in life. Once again, going camping, rolling in Brazilian jiu-jitsu, which for someone with herniated discs in the lumbar spine is not a realistic option. But I no longer have herniated discs. And so I no longer have that problem. And it frees me up to become whom I want to be and
Mhm.
whom I'm destined to be.
Sure.
And so, I look at this from a spiritual point of view. It's become my purpose in life. There's too much pain and suffering going on in the world. And, you and I want to be a light, a bright, shining light in the world, saying that, we can't help everybody, but we can help the helpable.
Sure.
And so I want there to be an opportunity for people to be able to have access to this here in the United States, here in the metropolis of Atlanta, where you can be in a first-rate city, have a first-rate procedure, have a first-rate experience, and know that you did the best thing you could do for your health in your situation. Know that you just checked every box and said, I did the best I could for myself and for my loved ones, through the research and the decision making, and eventually, ultimately, the experience and the outcomes of trying regenerative medicine as an option for your health concern.
Part of this description under the podcast will be how to reach out and get in touch with you, your location, which I encourage anybody, not just in the Hotlanta area, but around the world, if you want to see a top-rate facility.
Fly direct from anywhere in the world.
Yep, yep. You are definitely the one to see. And again, I'm proud of you. I'm so happy that you're my dear friend and will be for life.
That's right.
I don't, envy you sleeping on the floor of a tent at camp, but I do remember those times, and I do miss them dearly. But I think I would have to be running off to the hotel, to sleep on a bed and get a hot shower.
You can only appreciate the hot shower and the bed of the Ritz once you've
Uh-huh.
gone through scout camp.
Right. Is there anything else that you'd like to say to anyone out there listening?
I just encourage anyone that if you or a loved one is dealing with a health concern that you have not found the solution to, you've tried and tried and tried and you're at your wit's end. Perhaps you haven't tried one more thing. And I encourage you to take a look at regenerative medicine, do your own research. There is now, unlike when you and I started, there is a ton of research out there on the successes, the testimonials, and the science of regenerative medicine. Give us a call. Have a conversation. It costs you nothing, but we'd love to be able to find out whether or not you or your loved one is a possible candidate for such type of procedures. Like I said, we cannot help everybody. We can only help the helpable. But God willing, if you or your loved one is that type of person where you may have been told certain things, you need this procedure, or you're gonna have surgery, or all these negative types of things, give us a call, have a conversation, and we will give you the truth of the matter. And if regenerative medicine might possibly offer you resolution to your problems, we're going to let you know that. And only through proper diagnosis, through proper diagnostic testing, getting a second opinion on the situation, can we truly build a picture as to what an outcome profile might be. But it's definitely worth your while to find out if there's a chance that you might be that candidate. Because if you are, I'm going to tell you from my own experience, it'll change your life and it'll give you your life back. Now, it won't be the old life. It's going to be a brand new life, because you too will have the testimony, and it'll then become your obligation to share it with your friends and family, because guess what? They're suffering too. And so that's how the light grows in this world, and how we can do a little piece to try to relieve some pain and suffering, in our country, in our local community, and hopefully around the world.
Very well said, and so true. Last thing I want to tell people is it is a misconception that you cannot get these procedures in the U.S. Everyone seems to think that they have to go out of the country to get these, and that's just certainly not true. You can get all this right here in the U.S. We have a number of locations throughout the country. Again, go on the stemcelldoc.com website, look at the locations, tons of education on it, tons of frequently asked questions, and then call in, and we will set you up with the right location, right doctor, and see how we can help change the quality of your life. As always, man, it's always a pleasure to see you and talk to you, and I am definitely coming down to Hotlanta soon. We need to spend some time together.
Yeah, come on.
And then what I'd like to do, Dr. Atlee, is set up another podcast in the future and to start talking about conditions and things that we see every day. And so people can get a good idea of what we do. And also announcing that you and I are going to start doing some clinical studies. We are going to pick a few specific conditions and do some clinical trials. And that'll be put out there to the public to see who is a candidate for those trials.
I'd love to do that.
Awesome.
God bless you, brother. I love you, man.
Love you too, and we will talk to you soon.
Be well.
Thank you.